Taiwan registered one new imported COVID case on Tuesday. He's a man in his 40s who recently returned from working in China. The last time Taiwan saw a case imported from China was 8 months ago on February 13th.
China is seeing signs of a resurgence of COVID spread. A new cluster of cases has emerged at a port in Shandong province after nearly 2 months without domestic transmission.
Today, we have one new imported COVID case. The previous case imported from China was case number 13 on February 13th.
For the first time in 8 months, an arrival from China has tested COVID positive in Taiwan. Case number 530 is a Taiwanese businessman in his 40s who went to China's Jiangsu province in February for work. He returned to Taiwan on Saturday with a cough and other symptoms. A test administered upon landing turned out positive.
When he was in China, he purchased some medicine on his own. He didn't seek medical treatment there, so he didn't suspect he had COVID.
Meanwhile, China's Qingdao is seeing a new COVID outbreak, a sign that domestic infections could be resurging. In Taiwan, there are mounting concerns over a new distribution deal for vaccines created by a German biotech firm. Reports indicate that this vaccine candidate was co-developed with China's Fosun Pharma.
China's Fosun Pharma is just their agent in Asia, so they have a stake in the company, but it's just 0.7%. BioNTech's three main stakeholders are all German companies. Together, they hold 75.11% of shares. On September 15, 2020, the company received a grant of 375 million euros from the German government to speed up COVID vaccine development. If BioNTech were Chinese funded, the German government wouldn't have any reason to give them the funding.
According to TTY Pharma, the first batch of 10 million vials could be delivered as early as the first quarter of 2021. That's enough to vaccinate 5 million people. Storing vials on reserve will be a challenge as they need to be kept at -70 degrees Celsius. The higher the temperature, the shorter the shelf life. The CECC said it's still working out the logistics.
It's more feasible to have the vaccine be administered at a few locations. It's different from the way we've administered flu shots in the past, with 3,000 or 4,000 clinics offering the vaccines.
As for domestic vaccine development, officials say the soonest one could arrive is the second quarter of 2021. The CECC says it's pursuing all channels to obtain enough vaccines to get Taiwan past the COVID era.